Isn't that the story of 2020, Ryan? We're always muted. Aloha, good morning. Happy Aloha Friday. It is the day after Thanksgiving. We hope that you had a healthy and happy celebration. I know in my family it was over Zoom, other than the people who live in my household, but it was still festive nonetheless.
That's right. A lot of people finding creative ways to celebrate Thanksgiving this year. And of course, we want to thank all of you for tuning in. We want to encourage all of you to share this video and to insert your comments. We have a guest who always has a great response and takes a lot of the viewer questions. Joining us is the Lieutenant Governor, Josh Green, who is joining us now live from his office at the Hawaii State Capitol. Lieutenant Governor, good morning. Thanks so much for joining us. First question, how was your Thanksgiving?
It was awesome. The gravy was kind of junk, but the mashed potatoes were perfect, and my family was doing great. So all things being equal, it was wonderful.
You know, we want to dive right into the lead story in the paper this morning, and it is the Safe Travels program, which we know you are leading. Tell us about your view of how this program is working right now, because in the paper we see each of the county mayors calling for some adjustments.
It's working phenomenally well. It can't keep every case of COVID out, as Dr. Fauci and I described a month ago, but it is working very well. We've had a lot of data, which we'll share, I hope, today. If you get a chance, I got the board behind me so you can get a glimpse of it. We'll maybe do some close-ups. But we started this on the 15th of October. We've since had a large number of people, over 400,000 people, come through Safe Travels, and we've screened almost all of them one way or another. Some people have had to go into quarantine, but our state has a comprehensive approach. And if you look at the numbers, you'll be able to see that the cases that we had the day before we started the Safe Travels program with no travelers, basically, our case counts were steady. I think it was around, I'll have to flip this thing, but like 90 a day or something. And yeah, there we go. We had 107 cases, 101 cases the day before Safe Travels began. Yesterday, we had 92. Our positivity rate before Safe Travels began was 2.8%. Now it's at 2.2%. It's lower. We had 105 people in the hospital the day before Safe Travels began. We're down 40%, down to 60 in the hospital. And this is all during the time where the mainland COVID case counts are up like 200%. They were, I believe, 165,000 cases today on the mainland. So Safe Travels has worked great. That doesn't mean it can't do better. I think the mayors want to continuously assess it. And of course, we all want to improve things, but the idea that you could keep COVID out, totally stop it, is a fallacy. The numbers don't lie. We have the same counts or better, essentially, than we did before Safe Travels began, but that doesn't mean we can't improve. So, for instance, we're doing the pre-travel test, right? The 72-hour pre-travel test. It's a little hard to get a test now, but look, it's not easy to travel anyway. We're trying to get through this alive. The idea that we would do wholesale changes probably is not the best idea, but adding to the program, the Safe Travels program, is smart. What Harry Kim has done on Big Island has been very helpful, having a test when you arrive. That makes sense. So rather than bitch and complain about it, it would be great if the mayor of Honolulu added a test like Harry did. Mayor did do something very smart. He got a lab that's going to be available. Do an antigen test on arrival. Add that layer of safety, add that layer of security, continuously recheck our assumptions. But it's better, rather than taking shots at it, it's better to look at the data. People are doing well, and it restores some hope. People actually can work. And remember, one last thing before you give me some questions. These 40 days, or basically 6 weeks, and the numbers have been slightly less. We're actually open now. Before that, we were pretty much shut down. We were not active in a lot of our industry. So we now are having time with one another. We are in offices, at lunch places. We have people traveling here, yet we have not seen a surge. But we'll have to do a lot of extra work to keep the surge from happening now that the mainland is going heavy. But having hope and jobs through Thanksgiving and Christmas is probably something worth celebrating.
We want to specifically ask about some of the plans that have been outlined. As Yanji said, each of the mayors are kind of asking for different things at this point in time. Specifically on the island of Kauai, we know that Mayor Kawakami has been worried about his hospital capacity. He's talking about the lack of ventilators, of course, and ICU beds, which is his reasoning for why he wants stricter rules in place. How do you, I guess, in the capacity that you're in, sort of manage that with the requests coming in from the island of Kauai and the mayor and what they're saying about their concern that with the rising case numbers that they're seeing, that it's becoming too much for them to handle?
Well, my understanding is there's no one in the ICU with COVID right now on Kauai. And I did speak with the leadership at Hawaii Pacific Health personally. They always are ready to be supportive because remember, Hawaii Pacific Health's healthcare system, which is Wilcox on Kauai, also is Straub on Oahu. And they've forever seamlessly transferred patients. But if Mayor Kawakami wants to take it an extra level safer, that's totally great. Safety is good. I don't think it's really my place to say what ultimately the governor decides with Mayor Kawakami. Mayor has repeatedly said he knows his community well, which is absolutely true. And he cares deeply about his people. Absolutely true. As do I, as does the governor. We have friends, family all over the state, every one of us. So what I would say is doing extra testing, which is what Mayor Kawakami and his team have wanted to do for some time, perfectly reasonable. The case counts are not very high on Kauai, and everyone over the last 7-8 months has gotten accustomed across the state to spread, even on Lanai, right? But because Kauai's case counts were so low, even the small number, and it is a very small number, comes as a shock to the system. So whatever they want to do for safety is their prerogative, and it's, I'm never going to complain about extra safety and health. I will just say that there has to be an understanding that you will not stop all cases of COVID. Another thing that you have to recognize is that through our surveillance testing and study, we found that the rate of returning residents with COVID is about 5 times higher than the visitors, which means that no matter what, residents are going to return to Kauai or to Big Island or to Oahu, no matter what. And even if you put them into quarantine, where are they going to go? They're going to go into their house with their relatives, with their wives and husbands and children. So from a reality standpoint, you're going to have some risk of spread because we are not going to close the entire state to returning residents, travelers with a safe program. That can't be done. That's not the way any society can function. But if they had extra testing, it's totally cool by me. It gets like this. It becomes a strange political football. It's not that for me, actually. It's really about health and safety overall, but it's the health and safety regarding COVID, regarding poverty, regarding ability to pay for food, ability to pay for rent and not become homeless. All of these things are health and safety, and the mayor and the governor will have to balance that when they finalize their plan.
The Mayor Kirk Caldwell is calling for some kind of phone tracking, perhaps, and a combination really of phone tracking and post-arrival testing. Is that something that you think the county should handle on its own? Is that something that, given the size of this county, where, the bulk of the visitors are coming here, is that something that the state would assist with, or is that really something that you think this administration, and then looking forward to the next administration, which takes over in January, is that something that they would have to handle on their own if that's something they want?
I'm sure the state will always be supportive. The state's given hundreds of millions of dollars to the city and county to operate programs. And so I think it makes a lot of sense to do arrival testing. I did some assessment of what that would look like today. We could do a test, an antigen test, get around $30 a test on all 12,000 people that came in per day. If you did that, it would cost you, it's not an insignificant number. You'll ultimately cost yourself between $10 and $15 a month, but you could do it. You're talking about 2 months. Now, that's a decision that the mayor has to make. Of course, I would say in fairness to the incoming mayor, he should be able to make the policy decisions that are going to impact all of the people for the next 4 years for Oahu. But the current mayor has set up a lab. It's perfectly reasonable to use his resources to do that same-day testing. The reason there's a value in same-day testing and doing it probably with an antigen test is because right now people are getting tested 3 days before. We probably should be even a little bit more open to 4 or 5 days, and if you're going to do a same-day arrival test, because then you have a 4 or 5 day spread, you're getting your second layer of protection. And if they want to do that hard work like the guys on Big Island did, they should do it. I don't know what their holdup is. We've been saying for weeks that it's valued on Big Island. Some testing's gone on Kauai. Some testing's gone on Maui. But Oahu, just because of its size doesn't mean it can't do it. They have a partner in the Kidney Foundation. There's lots of people that would like to do extra testing. It's probably a short window that that has to be done, because soon we'll begin to vaccinate our highest risk individuals. But let me come back to the reality of this situation. We have fewer people today that were positive than we did before we started with Safe Travels. Fewer people. We have a lower positivity rate. We have 40% fewer people in the hospital. Now, I recognize that everyone is concerned about what's going on the mainland with these large numbers, and I am too. But that's why we check these numbers every single day. In fact, we're not just checking them every day, we're checking them every 4 to 6 hours. So we're giving real-time data, and if we see a big uptick, you could even argue for more testing. But right now, the system is working. I don't know why people would want to make wholesale changes to a system where we've got the lowest rate in the country of COVID. We've got the lowest mortality rate in the country of COVID. The active cases per capita, I believe, are lowest in the country. And we're the only country that has significant travel because we have the Safe Travels program. So I would definitely not throw the baby out with the bathwater, but I would always recognize that if they want to add extra security and spend their resources, it's for the good of the people.
So one of those suggestions that the mayor has proposed is that second testing for those who have not been able to get the results or have not been able to take a test prior to coming, being able to take a test at that location that is set up at the airport, quarantining for 4 days, going back for second testing, and if also negative, then they would be released. Is that something that you think would be reasonable given the change in the Safe Travels program with the testing that and results that need to be in hand for these travelers before they arrive?
Well, there is some wisdom there, and there are some catastrophic mistakes. So first of all, yes, if someone does not have their test result in hand, because it was difficult, but they got the test in good faith, and they can test them then as an additional test. They've already gotten the right test, but an additional test, that is good. Here's the problem, and the mayor should know this. Shame on him if he doesn't, because we've had 100 discussions about this. But if you just allow people to test here without having tested on the mainland, it explodes the whole system. No one will test beforehand, which means everybody on the flight will be exposed to possible travel exposures if there are positives. The mayor knows that the governor has been very clear, really clear, that he wants people tested on the mainland first. In fact, he just changed the policy so you have to have your test in hand. So why the mayor of the city and county of Honolulu would suddenly suggest that you could bypass that and then just test here? That goes completely against the governor's recommendations. It would mean that you'd have thousands and thousands of people not getting tested. And you and I know only too well that if you suddenly had 10 or 12,000 people a day going into quarantine, it would be completely unmanageable. So that proposal was completely juvenile. But the other parts of the proposal are good, to have extra testing in addition to the Safe Travels program. And if people do get 2 tests, it's good. Another challenge I must point out to you, Ryan, is that one thing that we learned from the Safe Travels program is if you want to test people when they come to Hawaii, test them while you got them, right in front of you. That succeeded. They actually will test. If you want to test people 4 days later, they won't do it. They will not come in. And why is that? Well, first of all, they go everywhere, right? You can't find people, and you're not going to put a low jack on people, and that's not what we do in America. So that's not going to work. And in addition to that, their incentive drops off very fast because if they have to come in for a second test after arrival 4 days later and they test positive, they know they're going to get a 10-day isolation or a 14-day quarantine. And it's really hard to get them to come back in. You'd have to be chasing people down with so much law enforcement, it'd be impossible. We already heard the story last week that law enforcement is challenged with overtime and challenged with their capacity. Those are not realistic proposals. I'm not saying they're not well intended. They are heartfelt. They want to stop all COVID, which we have stopped, by the way. okay? But having some additional testing to fortify safe travels is a thumbs up. To blow the system up when it's working is a thumbs down.
Well, let's talk about that surveillance testing. If people obviously don't want to come in 4 days later, who actually is getting that surveillance testing? And can you tell us a little bit about what you're seeing in the broad population when once they've gotten here?
Yes. Okay, so the people that tested most easily were Harry Kim's folks on the Big Island because they were sitting right there and they got swabbed. They got the anterior nasal swab, and not much worse than picking a booger because it just was the anterior nasal part. And we got a lot of results. We got like 18,000 pieces of data. And then we got about 2,000 additional pieces of data, taking us to over 20,000 from the rest of the state, usually on day 4. People that went to our programs over at Queens, Hawaii Pacific Health, Kaiser, a lot of sampling. Now, the mayors would like more data. I would like more data, of course. Now, the governor's team has told us that we have finished phase 1 and they will turn it over to Department of Health for phase 2. This thing always should really be focused in the Department of Health because that's what they do. It's just they're so overwhelmed. Our team took it upon ourselves to support them. Phase 1 showed that we had, it was 45 cases out of, what was my number here? Hit my board. Excited. 45 cases out of 20,053. That was 0.22% of the people were positive. There may have been some additional positives that flew in from their pre-test were positive. That's a different set of data, as you know. So that was important to find out. We also found out something else. We had 425 people out of, like, at that time it was 393,000. Now it's 425, actually, I'm sorry, out of 405,000 people had symptoms. Those also got extra screening. That was just 0.11%. So we were able to survey and find extra cases as they traveled in. Now, surveillance studies are studies. It's science. It is not the same kind of thing as me telling you every day. We had 92 cases today, 120 the day before, 110 before. Maybe that was a misunderstanding on the part of Mayor Caldwell. It's science, okay? Our scientific team wanted to get a sample. Nobody ever samples 20,000 people to get their data. They would have been happy with 5,000 or 6,000. Now, we always aspired to get more. So what did we do? We invited 10% of the population that was flying in to go and test day 4. What happened? They don't want to go. Of course they don't want to go. They've already been tested negative. They don't have any symptoms. They don't want to go. Now, if we were having 200 cases and we saw a lot of spread from travelers, I would be freaking out too, perhaps, like the mayor is. But we don't have that. Now, the next bit of testing, if they'd like to do surveillance testing, they should do it. Or they should, they should welcome the help from Director Char. There's a lot of people that want to do extra testing. But testing, look, we're now 15 minutes into our conversation and we haven't talked about masks yet. That means we're insane. As we've seen better mask wearing, which it has been better everywhere, Kauai, Big Island, Maui, Oahu, you can see that our cases are better controlled. In fact, our numbers wouldn't even be this high, and they're not that high right now. They're the lowest in the country, except the prison lit up. And that's, that's the reality, unfortunately, of what can happen. So, again, everyone is well-intentioned. There's a lot of great work being done by the counties, the Department of Health, the Gov, and so on. But people need to take a deep breath and calm down. Wear your masks. Don't party too much over the Thanksgiving holiday. And let me vaccinate you if you believe in vaccinations in the coming weeks and months. That's the real solution. They want to keep talking about surveillance testing. They're spinning their wheels.
Let's talk a little bit about sort of the gatherings, of course, that happened yesterday, be it, small gatherings as many state officials have been encouraging, or some of them we've seen online that there were still some large gatherings with families coming together yesterday and maybe going into the weekend as well. At what point will we start seeing any sort of results from a surge from this gathering this weekend? Because we know a lot of it sometimes takes a while for people to get tests and the results to come back in. When are you expecting to get a better synopsis of what happened this weekend as we move forward into December?
10 to 15 days from now. So there's a couple things. First of all, the incubation period on the virus, the average period of time from exposure to symptoms is 5.2 days. However, you won't see the test results until a couple of days after that. The other problem we have is you're going to see fewer tests get completed over Thanksgiving holiday time because the labs just don't operate as vibrantly. But about 10 days, you will start seeing, if we're going to have an uptick like we did after 4th of July, you'll start seeing an uptick of the cases. I hope it won't be too significant. Most people were still kind of in their bubbles, right? So if you were with your immediate household, no risk at all. If you were with your household and say 2 cousins that you kind of are with anyway, not very much risk. If you were with a whole bunch of party fiends from all across the spectrum of your family and friends, you're all going to get COVID. It's going to spread, bounce around, and it's going to be a super cluster. So that's what people have to be careful of. If you really keep close to your household bubble, or if your kids, say, have a sleepover, but it's with those very children they're already in school with, it's already in their social bubble, no one is symptomatic, you're not going to have much risk. It keeps coming back to the common sense. Now, as people do gather, there are ways to deal with it, because I don't want to be a prude about things, right? I know people need to have social interaction, even though it's a little riskier than before. The social interaction can be done somewhat safely. I don't recommend gatherings, but if you do see anybody that's not in your bubble, wear a darn mask the whole time, except when you're eating. And when you're eating, have 6, 8, 10 feet between you. Yell at each other across the table, but have the mask on, and that will keep the cases really low. Each week that we get through this, I'm kind of doing a quiet dance at home, because each week we get closer to the vaccination, which will start mid-December for our highest risk people. Each month we get through this, people have learned their lessons and pretty much slowed down their significant travel. So we're getting close to a very big success, but it could get out of control fast. So that's a super long answer. I apologize. To just chill out with your family, but people will do what they feel they must do. And there has been a lot of isolation and suffering, and I'm cognizant of that.
You know, on the other side, Mufi Hanneman was quoted as saying that the new restriction to have the test in hand is too restrictive, and that it's going to slow down tourism, and it's going to be a big burden, because people are going to say, you know what, I can't meet that threshold of having the test in hand within 72 hours. Forget it. I'm going to travel somewhere else, or, I'm just going to skip Hawaii for now. So it feels to me like you're kind of getting pressure on both sides. You have the county mayors who are saying we need more testing. You have the hotel industry that says that the current 14-day or the current, having it in hand is too much. What do you side? What's your response to Mufi Hanneman's criticism on this? He obviously represents, for the viewers who don't know, the Hotel, Lodging, and Tourism Association.
With the exception of rooting for the Kansas City Chiefs, Mufi has made some very good recommendations and had some very good opinions in the last several days. That 72-hour window was always arbitrary. If we wanted to perfect the system, I could tell you what it would be. You would allow for a 4th day where people could have more latitude to get the test. And then you would ask the counties to test everybody with an antigen test on arrival. That gives you a double test, a window of opportunity. It's what my surveillance team recommended. Then what you would have is everyone would come in and have their result already done. They could reschedule if they get a positive, obviously, right? They're not going to travel to Hawaii and sit here for 14 days, and they can't get on the plane with a positive test. Nobody's that nuts. So that would, first of all, put us in a place where we could actually get the test uploaded in a more realistic way. We've seen that safe travels has prevented significant spread. The spread has been in clusters still and in community spread, not from travel per se. Then it makes more rational the recommendations from Mayor Caldwell. Mayor Caldwell already has some very smart plans, because he's really focusing on security for a small island. Everybody will get behind it on Big Island. Already they're testing as many as they can, if not everybody. And then you have that spread. So that does make a lot of common sense. I did share that exact proposal with the leadership this morning. Yes, there's pressure on me from the mayors, because they see the risk, and I respect that. I like to see the data and use the data, but they do see the risk, and they're certainly making very good points, particularly out of Kauai, where they had no cases. The secondary pressures are really about the future, right? Because right now, we'll take yesterday, Thanksgiving. I saw people, as we served meals with Salvation Army, that I've never, ever seen before or imagined would have food insecurity. We serve thousands and thousands of meals to tens of thousands of people through their car. We're dropping 10, 12, 15 meals in cars. And these are individuals that can't afford food right now. So I don't know what the time frame is on in people's minds of how long they think that we can sustain this kind of pressure on society. It's not infinite, okay? If the numbers were surging, if the hospital numbers were up, if we were seeing a surge in fatalities, then you have to make the case, shut it down. You have to begin to describe what that looks like. But when that is not what's happening, then you should have sensible recommendations. So we'll see. We have been doing pretty well. I did talk to the team between 5 and 6 this morning. The airports did a good job yesterday. They were able to clear 90% of the people. It was not a big surge because of this 3-day rule yet. We do have some people canceling trips. My aunt and uncle canceled their trip because they said it's a little too risky to wait on the 3-day thing. And they just as soon come in January, February. They're retired, right? So I accepted that. But there are thousands and thousands of people out there making that calculation. If we have fewer travelers because there's more COVID and it's harder to get a test, well, that's a reality of the system and that's acceptable. But we should not make the rules so difficult that we can't safely test people, safely screen them and trace them, and then, do our thing, have tourism.
Before we wrap up here, I did want to ask, as we head on into December and the end of this year, we also know that CARES Act money will be coming to an end. And along with that goes a lot of resources that the state has relied on with the National Guard, with support with contact tracing, with so many efforts that we're seeing. Are you at all worried that when the end of this year comes and we lose all that CARES Act money, that there will be a big drop-off in the amount of support that the state has been able to get because of this?
I am worried about that. I absolutely am. We do have contingency plans in place. General Hara has done an exceptional job preparing us, making sure that we will have some proposals and National Guard support. It can't possibly be as robust as it has been for these last several months. But I do think, and forgive me for wading into national politics, but I do think that the Biden presidency is going to yield a negotiation for a multi-trillion-dollar additional support program for vaccinations and accelerate the vaccination program, which is in some ways the holy grail of this, right? Get everyone vaccinated that wants to, that chooses to. 2, I do think that they will offer an extension. I would be very surprised if we have to give any of the dollars back. Representative Case has made a very good statement or two about that. I don't think we're giving our money back. And there is some flexibility. It's not perfect, but we are able to move some monies, of course, into the unemployment fund and other things. We have been able to a degree, prepay. For instance, we've been able to buy a lot of additional tests, and that is helpful. So we will have some tests there. We, of course, are able to fund our Department of Health staff. Can we maintain the 426 contact tracers? I certainly hope so, but if we can't, then we have to keep our numbers lower. I think that you're going to see a new era in America to focus and end COVID, and that's what we're doing for the first 6 to 9 months. Forgive me, but you guys will probably be reporting on COVID all the way through the summer. But hopefully it'll be vaccinations. It'll be success stories in a lot of other states like ours. I don't want to jinx this because, in 3 weeks we could be living in a pool of COVID again if we do a bad job with mask wearing or if we let our guard down. But the Biden administration is going to bring resources, and we are working very closely with the current administration on the vaccine program. They've been honorable and worked with us to get the plans in place. So I'm optimistic that we can do it. I don't want to lurch from one policy to another, like I read in the newspaper today, but I will respect and honor any request and support it if if the mayors think that there's extra safety that can be applied. But it should be analytical. That's why I busted out the whiteboard today and the real numbers, because I sometimes do grow a little frustrated when people launch a little hand grenade at a program that's actually doing better than any other state. Why would you do that? So let's come together. Let's all support one another and be safe and wear our masks. Then I would assume we're going to get through the last stage of COVID okay.
I want to bring in just one quick question. We did our best to summarize because we've been getting so many questions and comments, and believe us, Ryan and I are reading those as we're talking to you at the same time and trying to bring those into our questions. But Anne has a question, and this is something that I was interested in as well, because last time you were on here, you kind of gave a range of percentages in terms of mask compliance island by island. How are you tracking that, to answer her question, and where are we on that?
We're better. The Department of Health does surveys and studies, and we are up 4 to 6% across the state. We have now tipped over above 90% for, I think, several of our counties. Unfortunately, it's on my big board and not on my smaller board. I can get those numbers out. Maybe Brooke can grab them for me real fast. We have a couple seconds from the big board, but we're doing better. We were up between 4 and 6% for mask wearing, and that was a nice thing. It's probably a reflection of the clarity that the governor brought with the mask mandate order. I still think that come New Year's, when the legislators return, they may very well help us with a fine instead of the misdemeanor offense. That would serve us very well through the winter and spring. But mask wearing is the whole game. Let me give you these numbers updated right now. Okay, we're up to 90% mask wearing in Hawaii County. That's up 4%. Maui's at 89. That's up 4%. Honolulu's at 88%, up 5%. And Kauai jumped 6% to 82% in the week past. Now, I do get vignettes from people saying nobody's wearing a darn mask when I'm out walking in the morning and whatever. Well, sometimes that's true. If you're out walking and you're by yourself and you are socially distanced, the mandate does not require a mask. But the Department of Health is focused on this. And if I could give one appeal to everybody, it would be, please wear your mask. Please wear masks throughout the winter whenever you're in public. If you do that, you will not have to endure me squawking about everything on the whiteboard for much longer, because COVID will settle down. We'll vaccinate each other. We'll be fine. Those are the kind of things that should be focused on. I think that we've made the case pretty clearly that the Safe Travels program can work well as long as we tweak it as necessary here or there. And there's a lot of fighting left to do against this virus, but it shouldn't be between ourselves. So I'll keep trying to give them some satisfaction on rational policy. And if people would do me the favor of continuing to send in their good ideas to my team, we appreciate it. Many of the things that we recommend to the governor come directly from the community.
I think Ryan is frozen, so I will say mahalo to you for joining us. Thank you so much for being here and giving us so much of your time today. We really do sincerely appreciate it.
Blessings for a Thanksgiving holiday that's safe. Take care.
Okay, thank you. And it looks like it's just me because Ryan's connection, oh no, here we come back. And there he is, all right. Yeah. Just like your work Zoom calls, if you happen to be on those, you know that they tend to drop out. But Ryan, interesting to hear the Lieutenant Governor there really pushing back against a lot of what we saw in the paper. And we invite you to go ahead and read that article online today because it is pretty thorough. Each of the county mayors calling for an adjustment to the Safe Travels program. Mayor Kawakami's being the most stringent in the terms of what he's asking for. But, you know, Mayor Victorino and Mayor Caldwell and even on Hawaii Island as well, Mayor Harry Kim, all saying that they're not satisfied with what's happening right now.
Yeah, and you're hearing the argument from the Lieutenant Governor about why he says it is effective with Hawaii's numbers comparatively with the mainland, and also looking at the data that shows that Hawaii's numbers are actually less than it was prior to the start of the Safe Travels program and allowing visitors into the islands once again. And so we will see and hear from.
And I think Ryan's having a little bit of trouble there on his connection. But as he was saying, we are going to hear from Mayor Kawakami. He is joining us on Wednesday. Governor David Ige joins us on Monday. This is all for next week. So we've got Ige on Monday, Mayor Kawakami on Wednesday, and then Dr. Libby Char from the Department of Health. This will be her first time on the program. Of course, she took over for Dr. Bruce Anderson, who headed up the department at the start of the pandemic. Dr. Char has been on the job for several months now, and we'll be very interested to hear from her about what's happening. You know, her take as a doctor, as a scientist, and how we're doing as a state. So we read all of your comments. We do sincerely appreciate them. Please like and share this video. We wish you a very safe and happy weekend, and we will see you right back here on Monday. Aloha.